Good evening. I'm going to take you through my evening exercise program. I do this every night. I also have my morning program that I take people through, and I have that video link attached in the comments or in the description below. But between these two and then moving every hour, I have been able to dissolve all my back pain. Now, I will also include that you need to have a diet that complements that, meaning getting away from processed food and increasing your water intake. Hugely important, and I always take an electrolyte to help absorb my water and also help to have better nutrition that can be absorbed into the body. Your spine, your discs, and your joints, in particular the joints, the synovial joints that make up your spine, your shoulder, your knees, your hips, it's about 60 to 80% water. So super important you use that. I also take every night my Calm from Make Wellness. This has things like ashwagandha, GABA, L-theanine, things that help calm your nervous system. Pain is communication from what's going on in your body to your nervous system. So if you can calm that down, your chance of decreasing your pain and sleeping better will improve. So for today, you're going to need a foam roll. You can also get a full-length half foam roll. If you don't have something like that, you can also just roll up a towel. Either one works. So I would recommend a foam roll. These things are really good. It's more aggressive starting with a foam roll like this than a towel roll or a half. So if you really have a sensitive back, start with a towel roll or a half full-length foam roll. Okay, let's get started into our evening stretch program. Okay, I'm going to start right here. I get the foam roll behind my mid-back. I'm going to support my head with my hands just like this. And then I'm going to just stretch my legs out. I want them flat and I want to bend back. Now during your work day, more than likely you've been bending forward and you have put your body in this closed position. In the evening, we want to totally open that up and get our spine moving, our joints moving. So we're going to come down, we're going to just open up our body and our spine. We're going to roll over that, and we're just going to roll through that foam roll. We're just going to rub it up and down our back muscles. This is a little trickier to do with a towel roll, but you can just gently kind of move and inch through that towel roll. Same kind of idea. This definitely works better with a foam roll, but you can kind of just wiggle your way on that. You just want to put pressure through the spine and the body. Okay, now once we're there, we've done that just for a minute, not very long. I'm going to cross my legs, give my legs a nice cross, drop my knees out. Now maybe you're tight and you're up here, that's okay. You just want to drop your legs down as much as you can. Now we're going to really get after this thoracic spine. This is where immobility through the middle back causes a lot of low back pain. So we're going to lift our hips up. Now again, if you can't cross your legs, you can have them uncross and do the same thing. But I'm going to cross my legs so I stretch out my quads a little during this. I'm going to lift up my hips and I'm going to drop my head down to the floor. Now I'm going to try and keep my head on the floor as I drop my hips back down to the ground, and then I lift them up and I drop down. Now the foam roll is just in the middle of my back. It's about middle of shoulder blade. Okay, but we're going to move that. I'm going to do about 5 times up and down, and then I'm going to roll a little bit towards my sacrum or towards my low back. Try and keep my head lift up, head on the floor. Try and keep it there while I relax my spine. This is going to be very aggressive for the thoracic spine. So if it's painful, again, a towel roll or half foam roll is maybe where you need to start. Okay, so you're lifting up. This is opening up your hips with the legs crossed. That's why I like that position better. Roll the foam roll a little bit closer to my low back. Do that. Okay. Now you should start that about mid scapula, but you can even start it up the top of your scapula shoulder blades and work that same thing. But start at the top, lift your hips, and you want to work your way down towards your low back. Okay, that should just take you just a minute or two. Really work through that mid back. You're going to find spots that are really tight, and you'll want to work through those spots and kind of spend a little extra time on those spots that seem to be a little tight or a little painful. Okay, so after I do that, then you'll have to, if you're using a towel roll, you'll have to roll it lengthwise. I'm going to take this, I'm going to give myself a towel, meaning I'm going to take that towel roll and I'm going to put this under my sacrum, my tailbone. Okay, so if you find the little knobby parts on your low back, you don't want it past that. Okay, so then I get that, that's going to put a lot of pressure on my sacrum. Your poor sacrum gets beat up, especially if you're sitting a lot. And we'll get there, and I'm going to bring my knees to my chest. If you can't do both, if that's too aggressive, just do one. Okay, but ideally we can bring both up and down, just like so. And it's just putting that pressure through. Now after I do about 5 to 10 these, then I'm going to come down and I'm going to drop my knees out. See, I crossed over a towel or foam roll. I drop my knees out, again, opening up everything, putting pressure on the sacrum, come up, come down. And I do about 10 of those, up and down. We're trying to improve the mobility of the sacrum to your lumbar spine and your hips. And it's a very dynamic joint system there. And so we have to move in a dynamic way to loosen that up. Feet crossed, come down. I'm pushing my knees out when I come down to give myself a hip stretch and to really put some pressure differently on that sacrum. Okay, and then after I do about 10 of those, then I'm going to put my feet down and I'm just going to rock side to side. Again, that pressure is on that sacrum. It's just going to really stretch and move it. The sacrum is really valuable, but it causes a lot of problem at the SI joint with people. Back and forth, just like that. And after I'm done with that, I am about done with my stretching. I'm going to roll my foam roll all the way, and then I'm just going to let my body relax, take everything and just open everything up. I'm just laying flat. This just feels good. Now, sometimes what will happen after I have done sacrum mobilization like we just did, or mid-back, you're doing an extension movement into it. So sometimes after doing this, laying flat, that'll feel good. Sometimes I need to get up and my spine will be a little bit sore and I need to go into flexion position. I need to let it all stretch out the opposite way after doing an extension movement like that so we're not sore. Okay, and you can get into child's pose if you feel like you can get there. If not, you can just come here, do that. Even a deep squat position is really good, and just hold that position and get into flexion. So that's all I do in the evening. It doesn't take long, it just takes really just a few minutes. You can do it while you're watching TV. Make sure you do the morning program in the morning, do this in the evening, and again, move every hour you can just do 10 squats, that's it. Or you can do a few lunges, just move during the day, get away from processed foods and sugars, drink more water, do these couple stretch programs, and you'll be amazed over the course of a month or two how your back can improve and decrease pain. I hope this has been helpful for you. Let me know in the comments if you have any questions, shoot me a message, and we will help you get your back in order and feeling good.